Hello, my name is Dr. Paul Hrkal. I'm going to be presenting on vascular health and hypertension. I just want to welcome everybody to our webinar series. For 2013, we're doing our webinar series a little bit different than we did last year, where different presentations in different months will be focused on different things, and the level of the material will be on different levels. So this is the first presentation that is going to be at a little bit more of a focused level, where I'm just going to be presenting some of the most cutting-edge research and some of the leading opinions when it comes to vascular and hypertension. We really want to rethink some of the current and reevaluate some of the current strategies that we're now currently employing. So we're going to go through this presentation, first of all, looking at some really common myths and looking at the evidence, whether there's actually supporting some of these. And so sodium and cholesterol are probably the two biggest ones. And we want to look at certain things that we can actually take from those specific observation studies and see if we can apply them to improving our vascular health. When I look at vascular health, it's one of those things that in practice as a naturopathic physician, it's something you see very often. Yet it's often overlooked because it's often not as glamorous as something, let's say, like sports medicine, which I'll see a lot of, or hormones. But it's actually very, very important. And really appreciating the actually very recent research on vascular health really will highlight the importance of improving blood flow and improving vascular function. And that's the two questions we're going to pose today. I'm just hoping at the end of the webinar that you're going to be able to have an appreciation or better appreciation of what drives atherosclerosis, or the hardening of arteries, which is a very commonly understood thing, and the most people in the public would understand this fairly well. And what are the key factors in determining vascular function? And that's something I'm going to be reiterating, vascular function, throughout this webinar. Because in the natural health field, we want to not just look at reducing things like cholesterol, but we're going to be looking at how do we improve the function of things. And our blood vessels are not simple tubes or hoses. They actually are a very active, almost environment, and we can even say organ type of system, where there's different layers of cells and they react to the environment and inflammation, oxidation. We're going to finish up the webinar looking at some key diet and lifestyle and vascular health supplements, and maybe looking at ones that we haven't looked at in a while, and also re-examining the evidence behind some of the ones like CoQ10 and magnesium, things that we've seen, and now we can maybe actually have a deeper understanding of how we can apply that to improving our health. Just a little bit about me before we get started. As I mentioned, I'm a practicing naturopathic doctor. I practice in the Toronto area, and my real passion, and I do work with AOR as a medical advisor, and through that, and also through my practice, my real passion is to really synthesize the research and the clinical experience of integrated physicians, and really make the science simple, whether that's through education or whether that's through patient interaction, or through talking with colleagues and public members. My passion really is to make things easy to understand and applicable to people's lives. Okay, so I'm not going to talk too much about some of the common things about cardiovascular disease. For this webinar especially, I really want to make it as rich and as full of important and valuable information as possible. So we're going to kind of skip over some of the pathophysiology of cardiovascular disease. Other than, I just do want to say that obviously, and we know that the top three killers, cancer, heart disease, and stroke, they kind of flip-flop who's leading the pack, but heart disease is a very, very important factor. And the thing I do want to point out about this is that because so many other diseases, for example, you see Alzheimer's disease number 7 is dependent on blood flow, and actually the health of our blood vessels and the heart and the health of our heart actually predicts a lot of things that occur, let's say, in Alzheimer's disease. Or for example, on number 6, diabetes. actually has a huge vascular component. So we're going to touch a little bit on that because there's actually quite a bit of interplay between all the top conditions here on Health Canada's top 10 list. We are going to kind of focus on hypertension, and that's really going to be the lens that we're going to be looking through, because hypertension is one of those risk factors that actually has a very strong and very definitive association with cardiovascular endpoints. And what I mean by that is actually a person dying from cardiovascular disease and having a negative impact on their mortality or morbidity. We know that for every increase up to 20 millimeters of systolic blood pressure and 10 millimeters diastolic, over and above 115 over 75 doubles the risk for a heart attack. So obviously hypertension is a key thing. And what, again, as I mentioned, what I want to focus on is not just on the hardening of arteries, but I want to talk about what are some of the things that are occurring that might be causing that, and some of the things governing the dilation or constriction of blood vessels, which ultimately is what hypertension, the definition of hypertension. So that's something I want to focus on, some of these things from a more functional perspective. Before we get started into talking about some of the key natural nutrients and interventions, we have to examine some of the common myths associated with vascular health, and whether there actually is some merit to them, whether they actually are myths. So the first one, here you can see a Time magazine cover, and this is actually from the 1980s, I think 1984, if I'm not mistaken. And that's really where a lot, around the time where cholesterol really was made to be the big enemy when it comes to heart disease. And now, contrast that with what you see here on the right, where cholesterol actually now is being questioned whether it actually is the driving force behind heart disease. So these are some of the things that we're going to examine. So first off, let's talk about sodium. Sodium is one of those things that there's a definite link between high sodium intake and blood pressure, and there's definitely a link to increasing cardiovascular disease, and that's what CVD stands for there. And so the more that you obviously take in, 20% increase or risk for every 1 gram per day. And we have to keep in mind, though, we have to look at this a little bit critically, saying, you know what, let's look at this at a deeper level. And the fact that I do want to state is that about 90% of salts or sodium that a person may be taking in throughout the day is actually added salt. So what does that mean in terms of more graphic representation? A lot of times people are very scared of the salt shaker. And if you look actually at the proportion of salt in a person's diet that comes from, let's say, a salt shaker, you actually see that while eating and home cooking, you can see that only makes up just a combination of 11%. The rest of sodium in North American diets actually comes from processed and prepared or restaurant foods, over 75%. This is really interesting because whenever there's something that the research says there's a link between cardiac death and salt intake, is it actually the salt that is the issue, or is salt more of an indicator that a person is eating a diet that is high in processed foods? And we know that in processed foods, it's not just about the salt. So there's the question behind salt. Is it more of a biomarker that's indicating a person's not eating a healthy diet, a diet that's processed, or is salt actually the cause or contributes to hypertension? And so this is the first big kind of strike against this sodium issue, calling into question whether it actually is connected to hypertension. So let's look at this a little bit more in detail. And the thing that we have to do is look at, well, you know what, if we're asking people or we're stating that sodium is causing hypertension or is definitely contributing, why not reduce it and see if blood pressure is positively improved? And this very recent trial was a Cochrane review, so it's a very well-respected review They looked at the evidence and found that sodium restriction, so reducing sodium in people, found that there was really not a strong correlation or any benefit on cardiovascular death, morbidity, mortality, and actually on hypertension. Now, that being said, there may be a certain group of people, the study found that these people may be actually sensitive to sodium, and they actually would be very beneficial to reduce sodium for these people. So overall, definitely reducing sodium would not be a bad idea. However, is it really the big villain that I think we all make it out to be? The research really is not supporting that approach. If you have resistant hypertension, reducing sodium at that point may be a good strategy because you may be actually sodium sensitive. So in the same way that beta-carotene really in about 10 years ago, or maybe a little bit longer, actually came out as being the big savior as an antioxidant. They just realized that beta-carotene actually was indicating a diet that was higher in fruits and veggies. On the opposite, sodium may be doing the same thing when it comes to hypertension, vascular health. So let's look at the next big issue that we often even hear in the media now, is that this whole idea about fat, saturated fat, cholesterol. We look at our neighbors across the Atlantic and we see that Europeans, especially the French Mediterranean populations, they have higher intake of saturated fat than we do here in North America. They drink more alcohol to boot, but they have half to 1/3 of the North American heart disease. Now, this has kind of made researchers scratch their head and really ask the question, why is this the case? And there are, a lot of theories why this might be the case, but looking at possibly some of the lifestyle, definitely a huge factor. The French people have actually the most vacation days out of any other developed country. Also, some of the antioxidant status and good fat status, the omega-3s, actually may be counteracting some of the bad fats. So there's some theories around that. Resveratrol is another theory in terms of wine drinking. But it really begs the question of really trying to look at this a little more deeper. So let's look at what does the research say when it comes to cholesterol. So again, like sodium, there definitely is a link between cardiac endpoints, so that's something like getting a heart attack or even a stroke, and actually looking at some of the evidence behind high triglycerides, that's what TC stands for, and LDL levels. They found that in asymptomatic people that did not have a cardiovascular event before, they found that it was not associated with plaque burden, coronary plaque burden. So this is a measure, again, of actually the material that blocks the blood vessels in the heart. There was another study here in Crusoe in 2008. His research group found that a diet higher in saturated fat actually reduced the progression of atherosclerosis. And so they found that actually decreased the small, dense LDL. And what we need to also appreciate is that we often look at LDL and HDL and cholesterol as all being bad. However, that's really not the case. We really need to fully understand the different aspects. Even within LDL, there's different sizes and there's different forms of that specific molecule. For example, there's a theory that the really small, dense LDL particles actually may be contributing more to coronary plaque or atherosclerosis than actually normal, larger size LDL molecules. So there is differences between types of cholesterol. Calcified plaque burden is something that has been strongly linked to adverse coronary effects, or events, I should say. So again, looking more specifically, instead of looking at cholesterol levels, looking at a measure of actually the hardening of arteries in the calcification, found that a number of studies actually found that total cholesterol and LDL did not actually correlate with artery calcification. And statins, which are the primary therapies for reducing cholesterol, did not actually affect calcified plaque progression. So looking at the bottom, and actually looking at kind of the flow, cholesterol leading to atherosclerosis leading to cardiovascular disease, calling into question actually that connection behind cholesterol to atherosclerosis and finally to actually cardiovascular disease. We need to actually look at a little bit deeper of what may be driving this. And so when some of these researchers actually looked at, okay, so if it's not the cholesterol, then it's now the calcified plaque. What is driving the hardening, the calcification of these plaques? And they actually found the key underlying factor was insulin resistance. And that's why I mentioned right at the beginning of the presentation, diabetes, even though it's number 6 on Health Canada's top mortality list, diabetes and insulin resistance is a very, very strong connection to a lot of other things, especially cardiovascular disease. Alzheimer's being another one that's a very, very strong connection behind insulin resistance and diabetes. So insulin resistance actually has been found to promote calcified plaque. And looking at some integrative approaches, they found that multiple therapies, some of them being natural, actually found they had better responses and better results than just using statins alone. So just lowering cholesterol through statins was not good enough. Some interventions using niacin, so that's D3, omega-3, and vitamin D, plus some dietary changes, did influence coronary calcium scores. And we're going to come back and touch on niacin and vitamin D in a little bit because those actually may be impacting something at a little bit of a deeper level, and we'll explore that in a few slides. So while we're on the topic of cholesterol and then looking at what's driving calcification in the arteries, we have to look at sugar. And so now it's actually becoming quite common knowledge that sugar, especially when it comes to common things like weight loss, things like diabetes and now cardiovascular disease, sugar actually is more harmful than fat. And this is a study done 3 years ago by Dr. Jacobson's group, and they looked at over 50,000 Danish men and women. And what they did is that they actually looked at a group of people with their fat consumption, and then what they did is they replaced that fat, that saturated fat, with fruits and veggies and whole grains. And they found when they replaced that those people actually had a significantly reduced risk of a heart attack. But the really interesting point was when they replaced that same saturated fat, which has been promoted as the driving force behind cardiovascular disease, when they replaced that saturated fat with refined carbohydrates, that's what CHOs stands for, so they found an even bigger increase in the risk for having a heart attack. So this study really showcased, not just in the realm of diabetes, but application in cardiovascular disease, that it's actually the insulin resistance and high glucose in the bloodstream that actually is more harmful than having saturated fat. So the study doesn't prove that saturated fat is safe. What it is saying is that definitely a diet that's high in fruits and veggies and whole grains can have a protective effect, but in terms of the scale of what the most harmful thing is, refined carbs really top the list according to the study. And we can know that, again, that's a connection behind insulin resistance. I also want to talk about the stress connection, often understood but overlooked, because we all know that high stress levels increase blood pressure. We've all probably experienced that in our lives, where we get into a stressful event, we're frustrated, we're anxious, we're irritated, our blood pressure goes up, our heart starts racing. That's a common, normal reaction. However, when this is occurring over and over again, our hormones that are responsible for dealing with stress, specifically cortisol, cortisol actually will increase artery calcification. That's what this study, again, a very recent study found, cortisol reactivity. So the response the body had to cortisol and how quickly or how imbalanced it actually was, found that those people actually had a greater proportion of calcified arteries. Some studies actually found sleep apnea and depression, so being related to calcification. So really, we can't just look at the standard dietary factors. There's a lot of lifestyle factors that may be playing a key role. And even if we just look at cortisol being the stress hormone and some of the effects that it has, you can see one of the effects of cortisol is that it actually causes peripheral insulin resistance. And peripheral insulin resistance is good in the short term because it actually promotes the energy, glucose, to be given to the areas of the body, the muscles and the brain and the heart and the lungs that need it, and not given to the peripheral parts of the body that really are not essential to surviving that stressful event. However, when that stressful event becomes long-term and every single day, you can see that causing insulin resistance is not going to be a healthy thing in the long run. This is a graph I really like showing from Dr. Juster's group in 2009, really just highlighting the progression of how stress causes disease. Again, we all know stress is a killer. However, how does it happen? And this diagram really points it out very eloquently. You can see that, obviously, stress, the biggest key factor is perception. If we think an event's going to be stressful, it's going to be stressful for us. So that's the biggest key factor, whether an event will be stressful for us. But once that starts, it starts actually a cascade of pathways in the body that first of all occur at the cell or enzyme and receptor level, and that's actually the production of cortisol and epinephrine, and that progresses too. We have to remember, cortisol goes up, epinephrine goes up. What do those specific hormones cause in the body? And they actually will have metabolic changes in the body, so that's where insulin resistance occurs. That's where triglycerides are affected, cholesterol is affected, blood pressure is affected, even immune cells and inflammatory cells are affected. And finally, there you'll have a larger effect on actually having diseases, so cardiovascular disease. So again, highlighting the fact that stress can have a key connection to heart disease. On this slide, I wanted to point out some really new cutting-edge ideas that are being thrown around by some of the leaders in the cardiovascular field. And the first one I want to talk about is this idea of endothelial progenitor cells. We've all heard of kind of stem cells, and progenitor cells are like stem cells, where the body actually will make these in the bone marrow and then send them throughout the body as almost like a cell, a precursor cell for, you know what, I need to repair, I need to replace whatever's been damaged. And so this is a new measure of vascular function, and they found that these progenitor cells are very useful in terms of repairing when damage occurs to the vascular wall. So it's like putting a nice fresh coat of paint, smoothing out the drywall. You want these cells to have to be very readily available. And they found that actually a diet that's higher in vegetables, low in animal products, and adequate exercise found that there was the maximum amount of these endothelial progenitor cells. On the flip side, on a healthy diet, a diet that's high in refined carbs and even in saturated fat, did not have a great progenitor cell response. So it's almost like as if that diet would be inhibiting the healing mechanism in the vascular wall. Cholesterol efflux, that's another new idea, very recent. This idea of not just looking at, well, we need to lower HDL cholesterol, we need to raise HDL. What we need to look at is that the cholesterol efflux looks at what's the ability of actually this HDL cholesterol, which is very beneficial, to remove cholesterol from areas in the blood vessel where it can be damaged by free radicals and oxidation. So it's a much more functional measure, and there's actually some real interesting research surrounding resveratrol, and actually this being the possible mechanism behind the benefit of resveratrol, not so much as it has some anti-inflammatory effects, but more of its antioxidant effects, preventing oxidation and improving cholesterol removal or efflux. And niacin being one of those very important factors, also being kind of thrown around in this idea of removing cholesterol from the bad areas. The last kind of factor I want to talk about is dental health, another one that's often overlooked. And This was a very interesting study that looked at the link between gingivitis and heart disease and even atherosclerosis and diabetes. And really looking at why is this the case? So these studies found that people that had inflammation in an area of our mouth that we think is pretty insulated actually had very systemic effects. So what that's telling us is that inflammation anywhere in the body actually is a signal for some of these negative effects to occur, let's say, in the blood vessels. And also, especially when it comes to gingivitis, that's a bacterial infection. Bacteria can promote poor blood clotting, and that can actually lead to negative cardiovascular events. That's where the importance of vitamin D really, again, cannot be overstated, because one of the key functions of vitamin D is to regulate the immune system. And so vitamin D levels need to be optimized to prevent some of these negative inflammatory pathways and to keep these bacteria in check, to reduce areas in our body that may kind of have these hidden inflammation, or what's called loci of inflammation. Gingivitis in the mouth is a very, very classic example of that. So let's now move on to actually looking at what we can actually do about it. So we looked at some of the common myths, but let's look at some diet and lifestyle interventions and things that we can do, starting with the simplest. And I really like to do all my presentations like that, starting with the most simple actions that a person can take, and then moving on to some of the more advanced, because often the simple actions have the most powerful results, and the advanced ones build on the simple ones. So this is a common list of actually a checklist that I would give to a patient of simple dietary things that they should eat during the day that actually have some sort of evidence, some more than others, of reducing blood pressure. So 3 stalks of celery, so doing like a celery shake, garlic, olive oil, dark chocolate, pomegranate juice, and so on and so forth. All of these have some degree of evidence, and if you can get this, one of each of these throughout the whole day, you're really way ahead of the curve in terms of interventions, and oftentimes people will not need to go to more advanced nutrients or interventions. Also, there's a lot of diets out there for hypertension. Probably the few most well-known ones is Dr. Dean Ornish. Did a lot of research, I think about at least 10 years ago, did some really good research on having a diet that's low in fat, very low in fat, and definitely saturated fats and animal fats, a more vegetarian diet, exercise, real good lifestyle, reducing smoking, had some real excellent results at reducing very progressed atherosclerosis. So we know that there's evidence there. Dr. Caldwell Esselstyn, he's another one that I didn't mention here on the slide, but another pioneer in really looking at some of these most advanced cases in heart disease and atherosclerosis, and actually putting them on a very low-fat, no animal product, vegetarian diet with some real astounding results at pulling people back off the edge. The DASH diet, dietary approaches for stopping hypertension, really is probably the most well-known diet, and the evidence supports it, probably reducing blood pressure in the systolic about 10 millimeters of mercury. And also another diet, the caloric restricted diet, or the diabetes diet, so reducing refined carbohydrates, actually has a lot of benefits for heart health as well. So what we can do is take a little piece of all of these diets. So the common factors, again, being stress reduction, eating a whole foods diet, a diet that is low in processed fats and sugars, especially, because a lot of those things can promote inflammation and promote oxidation. From a dietary approach, there's some really interesting research I just wanted to highlight for you, because a lot of times we'll think of diets as being kind of the slow and often ineffective approach where, you know, you really get minimal results. But this was a study done in the early 2000s that looked at fasting. And fasting is a very interesting thing because it gives the body a break totally from any sort of input. So yeah, you're missing out on some of the nutrients. However, you're also taking out a lot of the negative things that may be promoting or driving that cycle. So a lot of clinicians will use fasting as almost like a reset or a restart button for a patient. And that's what this research group looked at, is what they did is they just fasted 1 or 2 days for these people. And they found that just fasting 1 or 2 days and then following that with a vegan diet of just 6 days, so that's just 1 week, they found that 82% of the people in this study reduced their blood pressure to below 120/80 millimeters of mercury. And people started at 160, 150, so quite high blood pressure, 140. And they found, and this was the most astounding result in my estimation, was that, let's here on this line, they found that the mean blood pressure reduction was 20 millimeters of mercury systolic in just 1 week. That's a very, very impressive figure. So again, some preliminary research showing fasting can have some positive effects. But what I want to look at here is that, okay, so fasting may not be a reasonable thing for a lot of people to do, and these were medically supervised fasting. So I don't recommend this for everyone. I want to be clear about that. But what does this tell us about some of the processes that are going on in vascular function? What does fasting do? Fasting has been shown to reduce inflammation and to increase nitric oxide. And because inflammation is reduced, oxidative damage that's driving inflammations can be reduced, and therefore it won't damage nitric oxide, and that's the way the pathway works. And we're going to talk about that. So reducing inflammation, increasing antioxidants, again, the common thread for dietary interventions. So how can we apply this to some common supplements and nutrients? That's really one of the take-home points, again, I'm going to emphasize throughout this webinar, is that what are the functional things occurring at the blood vessel, at the vascular wall, that are driving hypertension? So right now, looking at the dietary evidence, it actually seems that inflammation and free radical damage or oxidation really is the root cause driving force. Okay, so let's look at magnesium. And magnesium is one of those, again, well-known minerals, well-known interventions, but once you look into the vast research within magnesium, you really gain a new appreciation for its effects. We often think of magnesium right here at the lowest level the lowest line on this slide. Magnesium actually is a kind of a weak calcium channel antagonist. So it basically is the opposite effect of calcium. We discussed calcium previously, but basically the effect of calcium normally in the body is that it constricts, it causes contraction, it causes nervous actually activation. So the opposite of that would actually be relaxation. And so that's what magnesium does. That's why it has a kind of a more vasodilatory effect. Now, low concentrations or deficient states of magnesium actually have been shown to do much more than just improve vascular tone, but actually have an anti-inflammatory effect. They found that they improved endothelial, which is vascular wall dysfunction, improved platelet aggregation, insulin resistance, and hyperglycemia. Magnesium is extremely important when it comes to the function of insulin itself and actually of the production of insulin and the insulin receptor. So for diabetics, we're going to touch on this in a little bit, magnesium is extremely important for the function of insulin. We talked about insulin as being the driving force behind vascular calcification. So you can see how magnesium and optimizing magnesium levels really is going to be a very important thing when it comes to addressing cardiovascular disease. This is a very recent kind of graphic representation of what happens in a body when magnesium levels are low and calcium levels are raised. So firstly, this is typically what we see and understand magnesium being. We'll look at magnesium as kind of a preventing vasoconstriction, and in this case, low magnesium levels can contribute to hypertension by increasing vascular tone. Also, low magnesium levels can contribute to endothelial dysfunction, as I mentioned. There's the platelet aggregation, and finally insulin resistance. So you can see how, from a visual perspective, how it contributes to hypertension, atherosclerosis, and to diabetes, all just having low levels of magnesium. Looking at magnesium supplementation, there was a really good kind of a meta-analysis looking at the supplementation of magnesium on blood pressure, and they found that magnesium with a dose around 400 milligrams found that there was a decrease in systolic blood pressure, 3 to 4 millimeters of mercury, and diastolic by 2 to 3. This is actually pretty good. It doesn't seem like very much, but actually comparing it to some common pharmacological drugs and interventions, this is right around the range that those medications will work. Usually anywhere between 5 and 10. Magnesium has a fairly significant contribution. Keep in mind the average dose of magnesium here was about 410 milligrams. And again, these studies primarily were using magnesium oxide, which actually is an inferior form of magnesium, which I'm going to address in the next few slides. When it comes to magnesium, we need to not just look at the anion. We also need to look at the cation together. Both of these form very valuable therapeutic tools. So magnesium, when it comes to some of AOR's formulations, really the appreciation that I have for some of the diversity in the line, as we're going to see in the next slide, really showcases all the different benefits of magnesium. First of all, magnesium ortate. So this is the magnesium found in CardioMag. Magnesium ortate, a lesser known type of magnesium, but it's actually attached to the amino acid ortate. And ortate, like other amino acids, really good at improving the absorption of magnesium. So unlike magnesium citrate, where you can have that laxative effect, so like think milk of magnesia, magnesium ortate's an amino acid, so it's actually going to be upregulated. So it actually has the ability of absorbing magnesium very well in the small intestine, and it actually directs magnesium very well actually right into the cell and into the nucleus, actually, as it promotes the synthesis of proteins, glycogen, and ATP. There's some interesting studies that showed magnesium ortate showing benefit for hypertension, benefit for congestive heart failure, angina, and improving mitral valve prolapse. Magnesium taurate, also very beneficial. Taurine is an amino acid, excellent for, especially when it comes to heart, eye, and brain function. Specifically used and concentrated in those tissues, taurine has the ability to normalize electrical activity across nervous tissues in the heart and in the brain. So this is very important for things like arrhythmia. Also important things, obviously, for things like blood pressure, because taurine is going to be used as an amino acid by the heart as a muscle as well. And it also can counterbalance the excessive calcium load in the heart and compensate for B6 deficiency, because typically B6 will deplete both magnesium and taurine. So here's the magnesium lineup from AOR. Really a diverse lineup. The first three products, CardioMag, Magnesium Taurate, and Mag-K Taurine, are more of the cardiovascular indications. The last two, magnesium potassium aspartate and mag malate, are more for chronic fatigue for the aspartates, and malate is for fibromyalgia. Some really interesting studies with that. But let's focus on the cardiovascular magnesiums, where we actually see, you may look at the dose of the magnesium within the CardioMag as being just 50 milligrams. But remember, there's a profound synergistic effect between the amino acid and the magnesium. So it's the chelate actually has a much stronger effect than, let's say, a chelate like magnesium oxide, where there's a lot lower absorption, so you don't need such a high dose. So don't get thrown off by the lower dose of magnesium. Some really great clinical results with all three of the formulas. The one thing often people will ask is, why is there a potassium in the Mag-K Taurine? And the reason is that the potassium and magnesium are like cousins in the body. They're like brother and sister. They're very, very close. And when magnesium levels are low, almost always potassium levels are also depleted. So when, for example, in diabetics, magnesium can be depleted through the urine, potassium can also be depleted because of the way that the kidney will expel both the minerals at the same time. Also, the question often I'll get is, why is the magnesium in the magnesium citrate form versus the magnesium taurine as a chelate itself? And you really need to appreciate some of the pharmacokinetics and some of the formulation behind it. There really is not a good source of magnesium taurine fully reacted available as a raw material. So AOR has to actually use magnesium citrate, which isn't a bad form of magnesium. It's actually a very rapidly absorbed form of magnesium. So there's a really good delivery of magnesium into the bloodstream. However, also the levels can go down quickly after, and you're going to be getting the taurine as an amino acid. So again, looking at balancing some of the benefits in each one of the forms. Arrhythmias, definitely go with the taurate, and when it comes to blood pressure and when it comes to function, congestive heart failure, I'd go with the CardioMag. An important note about magnesium. Magnesium can be lost. It's a mineral that is often deficient in a lot of people, and the common question is, well, how do you, number one, measure that, and why is it deficient? Well, it's actually very difficult to measure magnesium. A common measure is red blood cell magnesium, but it's not very accurate of actually predicting what the magnesium is within the cells of a muscle or the other parts of the body. What we do know is that magnesium is lost, especially in people that have any sort of issues with small intestine, so celiac, because that's where magnesium is absorbed. So any issues there, absorption can be impaired. So we may be eating foods like almonds that are high in magnesium, but we're not absorbing that magnesium. Also, diuretics, proton pump inhibitors, and antibiotics all deplete magnesium, and PPIs are one of the most commonly common causes of magnesium deficiency, and now even the FDA is warning doctors about the possible negative effects of long-term use of PPIs because it can cause low levels of magnesium. Okay, so let's talk about TLC. This is a formulation that, if you really didn't look into the research behind it, you really would kind of be tempted to kind of gloss over it, and some people don't really have a good understanding. But once you really get into some of the research and reasoning behind this formulation, it really is quite incredible. And so let's just quickly just keep in mind what is the sum of this breakdown. Just simply, what I'll use this formula for from a practical perspective is that it gives you 3 grams of vitamin C in a powder form that tastes fine, with a lot of these other cofactors. For the magnesium and potassium in itself, I would use it. So I think that is something that in itself I've been using as a good source of vitamin C. But let's look at specifically in terms of the formulation for cardiovascular health. And we'll talk about the lysine, proline, and vitamin C specifically. So this whole formulation actually really, the doctors that pioneered this idea behind this formulation, vitamin C, was Linnaeus Pauling and Matthias Rath. Linnaeus Pauling was one of the fathers of vitamin therapy and orthomolecular medicine, and he really had a passion for looking at vitamin C especially, and really all the different benefits of it. So he was a big believer in high-dose vitamin C. But what he was also looking at was that when it came to heart disease, there's the LDL and there's the HDL, but there's also these other lipoproteins, and there's one lipoprotein which is a component of the whole lipoprotein family, which LDL and HDL is part of. Lipoprotein A is actually been shown to be worse than LDL, because what it actually does is that it actually has an inhibited effect for breaking clots down. So it makes the blood more sticky or thicker. This is actually a really good thing from an evolutionary perspective, because if we got hurt or you were bitten by let's say, a saber-toothed tiger, you wanted that bleeding to stop very quickly. So people that actually were able to stop that bleeding actually survived longer. So that's why lipoprotein A is good in that realm. However, in present days, its action actually at inhibiting clot breakdown actually can be very detrimental, because we don't want clots to be present for a long period of time. We want to seal the blood vessel wall, seal the damage, and then we want to have smooth blood flow. Also, we have to realize that cholesterol, that lipoprotein A, delivers cholesterol to the area. The function of cholesterol, when we look at why the heck is it in the blood vessels and what is it actually doing, it actually acts as a type of filler, or acts as a type of plug at plugging up damaged areas. So if you think of the analogy of a drywall, where you would take a hammer and scrape that gypsum and you really leave a big nasty gash, cholesterol is used as a quick patch to kind of patch that up, so we don't have damage in the wall. However, it's when that cholesterol is oxidized, and when that damage occurs often from things like insulin resistance and high amounts of blood sugar, that now that patch becomes a plaque. So it's a short-term solution that actually has a negative effect. On the flip side, vitamin C, one of its main effects is actually plays an integral role in the formation of collagen, and in any tissue, but blood vessels also. So vitamin C is the long-term solution. Lipoprotein is kind of a short-term, quick fix solution. Now the problem is that oftentimes, because of our diet, and oftentimes humans can be deficient, whether through diet or genetic deficiency, we don't have enough vitamin C. So we have a short-term solution that's filling in for a long-term solution, which is vitamin C, which now opens the door for problems. So vitamin C actually doesn't reduce lipoprotein A, but it replaces it, because they kind of have the same action. Vitamin C over the long term can help repair that blood vessel wall by promoting new protein, new collagen formation. And you need about a 3-gram dose to do this. On the other hand, niacin, which we talked about earlier, that's B3, does reduce lipoprotein A, so it does have a very beneficial effect that way. Lysine and proline, these are amino acids that specifically have an effect on binding lipoprotein A, preventing it from getting to the wall, and actually preventing it from connecting with triglycerides. So the combination of vitamin C, lysine, and proline, Linnaeus Pauling found, and Dr. Rath, they all found that this was the key protocol, this combination, at actually improving cardiovascular disease, repairing blood vessel damage, and they found that studies improved functions in people in ADL's activities of daily living. The other benefits of this formulation is that you're going to get all the benefits of vitamin C, you're going to get taurine, magnesium. So I really, really like TLC as a great formula for not just immune boosting because of vitamin C, but great for cardiovascular disease. This is kind of a graphical representation of what we just talked about. You can see here, lipoprotein A will go in it and will inhibit the clot breakdown. So think of this damaged blood vessel as that's kind of a puncture in the blood vessel wall, or damage. So lipoprotein goes in and breaks it down. Cholesterol is put in and actually will patch up that damage, and so it acts like as a plug. What vitamin C does is that actually it will work on the blood vessel wall and improve its integrity, and proline and lysine will go in and actually inhibit this lipoprotein A, which is a factor that, again, to review, it promotes clotting and the breakdown of clots. So that's kind of the mechanism behind TLC. And once you kind of get an appreciation, you're like, oh, that's why, that makes sense. So Linnaeus Pauling was a real pioneer when it comes to cardiovascular health. Abram Hoffer, another a giant like Linnaeus Pauling, really leader in his field, big fan and big proponent of niacin and really looking at some of its effect, not just on managing things like mental health and schizophrenia, but actually for its effects on cardiovascular and on cardiovascular endpoints. And cholesterol, we know niacin has a very, very potent reduction in LDL, increases HDL, and especially increases this specific protein called apolipoprotein A. And this is a specific lipoprotein that inhibits, unlike the lipoprotein A, ApoA inhibits vascular inflammation, protects against endothelial dysfunction, and this is actually independent of if actually cholesterol levels are high or if they're low. So niacin is an excellent option for really addressing a deeper cause of what might be causing some of the issues with vascular function. Here's a quick just overview of what apolipoprotein A does. It has many different effects. It's not just inhibits LDL, but actually improves endothelial dysfunction. It actually has anti-thrombotic effects. So unlike lipoprotein A, it actually will help break down clots, and it actually has anti-inflammatory effects. So we want to, anything we can do to increase ApoA would be beneficial. So let's kind of switch gears and let's talk about calcium specifically. So we alluded to it through calcification already, but this was a study that came out probably about 3 years ago and really sounded the alarm bells in the medical profession, looking at, hold on, calcium supplements are now linked to heart attacks. And they found that just supplementing with calcium found that they actually had, those people had a higher chance of having heart attacks and strokes. And so again, the theory behind this is that increased amount of calcium can promote calcification and hardening of arteries. And this is where vitamin K really now is becoming a superstar, where we know vitamin K has effects on bone. It increases this protein called osteocalcin. But specifically when it comes to vascular health, matrix GLA protein is the protein that is responsible for the repair of soft tissues or the vascular tissues. Vitamin K controls this protein. It will actually turn it on. Low levels of vitamin K will impair the production of matrix GLA protein, and therefore will actually not allow it to do its job to repair the blood vessel walls. There has been some studies showing that for every there's a 9% risk reduction for every 10 micrograms per day of extra vitamin K intake. So there is some epidemiological studies and cohort studies looking at that. But there is studies that really point to this idea of vitamin K especially in animal models, actually reducing adequate amounts will reduce the calcification of arteries, prevent the loss of elasticity, and actually you're finding that things very commonly prescribed drugs like warfarin, which is a vitamin K antagonist, actually will increase artery calcification. So again, vitamin K, getting enough and through your diet, so that's through fermented foods, typically natto, the soy version, soy fermented food is a natural source of vitamin K. And obviously there's certain animal fats that will have vitamin K too, because vitamin K is a fat-soluble vitamin. MK4 is, just a quick note about forms, MK4 is the form that's been studied most for fractures. It's the active form in the body. And this is where a lot of the research on fractures and osteoporosis is being done. MK7 is kind of a new kid on the block, where there's some preliminary research saying that there may be a longer half-life, so it kind of sticks around the blood longer, which may be better as a precursor form. So there's still not a clear consensus as one is better. I think the common message is that get enough vitamin K. So your dark green leafies, and obviously when it comes to K2, that won't be found in dark green leafies. That's K1. Supplementing and eating fermented foods will help with that. Just a quick mention about CoQ10. Don't want to dwell on it for very long, but CoQ10, well known for reducing blood pressure. improving overall cardiovascular health. Really used for a heart failure and blood pressure are the two big benefits. And the third one is actually for statins, and we know that statins deplete CoQ10 levels, which can lead to myalgia or muscle pain. The very interesting thing I found about CoQ10 is that why does CoQ10 work? We know that it'll help the electron transport chain and the production of ATP in the mitochondria. But the two theories is that it may have an antioxidant action, which they find will prevent nitric oxide breakdown. We're going to talk about nitric oxide in a few slides. We know nitric oxide is very important for vascular health. And it actually boosts the production of prostaglandins, which are anti-inflammatory. So it has an antioxidant and anti-inflammatory effect. So again, that same recurring theme of antioxidants, anti-inflammatories, really getting at a deeper root cause level. Again, just a review of some of the dosing behind CoQ10, looking at ubiquinone versus ubiquinol. Some of the new research saying ubiquinone is better absorbed, especially in the more elderly population if the conversion rate is not as good. So you can see doubling some of the doses for ubiquinol. Very safe interventions been used in heart failure studies for well over 300 milligrams. So I would say if you're going to do ubiquinone, do 200 to 300 milligrams. Ubiquinol can go a little bit lower. But also because remember, CoQ10 is a fatty substance, putting it in a fatty emulsification like CoQ plus will increase its absorption, and also giving it with food will improve its absorption because we need bile salts to emulsify fats. Just again, reiterating this idea, what's better, ubiquinone, ubiquinol? Ubiquinone, it's not that it's not good. It's been used in a lot of studies, very positive. Used it for cardiovascular indications like heart failure and high blood pressure, preliminary studies on infertility as well. Ubiquinone is reduced to ubiquinol. AOR just recently launched a ubiquinol from a product line that is partnered with AOR called Ovos. Same principles as AOR in terms of research-based quality, really innovative formulations. Ubiquinol is an option for those that are really looking for a ubiquinol from AOR versus the standard CoQ10. There's a number of formulas that have ubiquinol in it. I'm going to touch on a few as we go forward. But again, ubiquinone is converted to ubiquinol, so we got to make sure that conversion process is good. And if there's a concern about that, if maybe you're not getting benefits from a CoQ10 supplements, maybe switching to ubiquinol will give you better benefits. Touching on antioxidants, I've presented this graph before in other webinars, and I'm just going to touch on it again. When it comes to antioxidants, you see CoQ10 down here. We're trained to think very linearly and one-dimensionally. CoQ10 does this. However, when we look at what antioxidants, and CoQ10 is part of that, what they do in the body, they actually don't work by themselves. They work in symphony. They work together. And they are part of a network. And that's what this formula, antioxidant synergy, is all based on. Antioxidants need to be regenerated and recycled. You can see lipoic acid, CoQ10, vitamin E, vitamin C, glutathione, all recycle each other, and they all have different areas of the body that they really have their most potent effects. Vitamin E is it's been studied so well when it comes to heart health and when it comes to brain health, because a lot of that area, there's a lot of fat that's there, and vitamin E works in fatty tissue. So vitamin E is going to be working at the level of the cellular membrane and fat. Vitamin C is outside the cell, glutathione is inside the cell. So we need to support all of these areas. Antioxidant synergy is an excellent formulation to support the various aspects of the antioxidant network. So not just doing one. One of the common concerns that a lot of skeptics of natural medicine will say, will kind of bring up, is that we'll look at all the studies behind vitamin E and vitamin C, and they really have not been as beneficial as we'd like them to be. And the answer to that is well, you know, because often these antioxidants don't work in isolation in the body, they really often fall flat, and that's true. These studies, often the results are not as positive as we expect them to be. But I would argue that that's probably because we're not using them in a way that our body uses them. And that's why a formula like Antioxidant Synergy, great clinical results with it, because it supports all the antioxidant pathways and regenerating the antioxidants. I want to talk about curcumin. We often don't think of curcumin for heart health. We think of curcumin for inflammation, which now we know inflammation is a big part of cardiovascular health. There was a really recent trial, and I found it very interesting, and it really supports curcumin for heart health. And they found that supplementing 4 milligrams of curcumin 3 days before surgery, I think this was stent heart surgery, and 5 days after, found that those people that supplemented with curcumin had a decreased chance of getting an in-hospital heart attack compared to those people that did not take curcumin. 30% versus 13%. That's a very substantial reduction for just 2 doses of curcumin. And again, lending evidence to this idea of curcumin not just being anti-inflammatory, actually being a very potent antioxidant. Another recent trial using actually AOR's CurcuViva formulation in the exact dosage, 80 milligrams of long Vita curcumin. So this is the curcumin that has superior bioavailability. It's a nano lipid emulsified technology where a small dose, 80 milligrams, which is worth about 20 capsules of AOR's regular curcumin 95, or about 8 grams, just for 30 days, found that positive reductions in triglycerides and, most importantly, increases in nitric oxide. I think this is probably the most powerful graph because, again, nitric oxide is the fuel for the endothelial cells for them to function well. And if the cells are not functioning well, then things like heart attacks can occur at a lot higher rate. Nitric oxide has an effect on the body, and we're going to talk about this in a few slides. It'll thin the blood, it'll prevent clotting, it'll prevent stickiness, obviously reduces hypertension, and it plays a very important role of governing this idea of vascular function. A perfect segue into the concept of vascular compliance, and we'll finish up with this idea. This is a new way of looking at heart health. It's a measure of endothelial function or dysfunction. Is a real much more functional measure of what's going on at the cell, at the cellular level in the blood vessels. So nitric oxide is very important here. We know inflammation plays a huge role here. Free radical damage plays a huge role. Vascular compliance has a very strong prediction with cardiac death, heart attacks, strokes, and unstable angina. So again, now researchers and clinicians are looking at more of these functional measures. So what can we do to improve vascular compliance? Well, the common sense thing would be to improve nitric oxide, because that's the key regulator of vascular compliance. We know nitric oxide is actually impaired in a number of disease processes, including diabetes, high cholesterol, especially the LDL levels, and hypertension. And on the flip side, we know that elevated triglycerides, sugars, and homocysteine can disrupt endothelial dysfunction. And the theory behind this is that actually these factors, like high amounts of blood sugar, high LDL cholesterol and triglycerides and homocysteine, what they actually do is they'll actually promote oxidization of nitric oxide. Nitric oxide is a very sensitive molecule, a very, very short half-life in the milliseconds. So you can't supplement with nitric oxide. However, you can improve nitric oxide by giving it precursors, L-arginine being the most common one. However, L-arginine has some really unfortunate drawbacks. So L-arginine typically is dosed at fairly high doses. and it requires nitric oxide synthases and an adequate amount of oxygen and a quite alkaline pH level for these enzymes to function. We know that nitric oxide is already being stressed by things like diabetes and things like hypertension. And so being such an essential molecule, researchers start asking the question, well, if L-arginine has these limitations, what are some of the, there has to be another pathway in the body that can produce nitric oxide. And when they started looking at the connection between fruits and veggies, especially veggies that are cardioprotective, why exactly are they cardioprotective? They found that actually the nitrate levels in these fruits and veggies were responsible for improving nitric oxide. So this is a new pathway that is a precursor pathway that, and they first looked at it through beet juice actually, and dark green leafy. They found that actually after 2 hours of consumption of beet juice, which is high in nitrates, it improved blood pressure, lowered blood pressure, improved nitrates and nitrites. We're going to talk about the pathway in a second. But this is the graph, really nicely showing that the blue line being the nitrate levels. The nitrite levels is the red line, so that's the intermediate step. And then finally, nitric oxide is responsible for lowering blood pressure. So a really nice cause and effect relationship showed in this study, which was actually published in the American Heart Association journal, Hypertension. The, nitric oxide now has a new pathway, so there's the L-arginine pathway. Independent of that pathway, there's the reduction pathway, and so that's why I mentioned the nitrates being converted to nitrites to nitric oxide. And this is really what this whole new axioma line from AOR is being based on. Knowing and appreciating all the benefits of nitric oxide and its effects in vascular function, we the line axioma really is kind of centered around that. Understanding how it actually is used in the body really gave me an appreciation for, you know what, this is a pathway the body has in place. Because there's some questions that obviously come up with, you know, nitrates and are you know, I thought they were related to things like cancer and things like that. If we look at how nitrates are used in the body, you can see number one right here. Nitrates are actually concentrated in the salivary glands, at number 3 you can see. Within the salivary glands, these nitrates are converted to nitrite by the bacteria, because the bacteria uses the nitrates as fuel. This bacteria converts nitrates to nitrites, and nitrites can be converted to nitric oxide much more readily than nitrates. And this is done again in the acidic environment of the stomach. And then finally now, nitrates almost act like a reservoir within the body for nitric oxide. So it's almost like we've injected or we've provided the body with a fuel or a precursor to nitric oxide without actually giving nitric oxide, because that's not a sustainable way of doing it. As I mentioned before, there's a number of benefits associated with a lot of research trials. There's actually quite a bit of research evidence behind looking at nitrates. They found that, obviously, it talked about blood pressure reduction that's been reproduced in a number of trials. There's improvement in sports performance, improvements in, obviously, vascular function, platelet stickiness, as I mentioned, reduces lipids and triglycerides, and reduces, again, as I mentioned, inflammation and endothelial dysfunction. So nitrates, via the nitric oxide, have some very powerful, very exciting clinical effects. And what I, again, found most interesting is that, yes, nitrates improve athletic performance. We expect this because improving blood flow, and I've seen this in my clinical practice, some excellent results with athletes in terms of being able to run longer, and without getting as tired and having that longer term energy, especially soccer players or more endurance athletes. And actually nitric oxide has an antibacterial effect, has a role to play in the immune system. But what I found most interesting is this last point right here. We've been talking about inflammation, we've been talking about antioxidants. Understanding antioxidants and this relationship to nitric oxide really is highlighted the benefits of antioxidants when we know that they're beneficial, but now we really have a better understanding of why they're so good for heart health specifically. Nitric oxide, as I mentioned, produced at the endothelial level, improves endothelial function. However, antioxidants, their beneficial effect is actually through nitric oxide and also through a number of other mechanisms. But one of the main effects is that it prevents the breakdown of nitric oxide. One of the things free radicals and oxidative damage will do is that it will damage nitric oxide. Just like oxygen, oxygen can be a very life-giving molecule, but exposed to oxidation, it can become a free radical itself and be damaging. So antioxidants protect nitric oxide and allow it to do its job. And you can see here, resveratrol, quercetin, green tea extract, and pycnogenol all have been shown to increase nitric oxide levels, which I find very exciting from a very functional perspective, because we know that supplementing antioxidants, even though they don't reduce cholesterol directly, they prevent the oxidative damage to cholesterol and to nitric oxide, which is very, very important. Just a quick note on nitric oxide, and just to highlight the ortho-heart formulation. There is a strong connection between the nervous system and hypertension. And obviously nitric oxide we talked about being very important for the vascular system. However, when it comes to controlling the vascular tone via the central nervous system, nitric oxide plays a very important role. And that's why there's actually quite a bit of research on GABA and by kind of connection L-theanine at lowering blood pressure. OrthoHeart, which is formerly called blood pressure relief, OrthoHeart now has L-theanine. Blood pressure relief is almost identical formula except that it had GABA in it. And one of the real big benefits of this formula, a lot of what people will as feedback would tell us, is that they found that it really helped reduce blood pressure. And one of the primary ingredients to do that was GABA, because it addressed blood pressure not just at the vascular level, but actually at a nervous control level as well. So GABA and L-theanine are very, very good at addressing that, and nitric oxide obviously plays a key role in that as well. So this is the Axioma line family. So you can see there's 4 products here. I think there's a new appreciation for why the nitric oxide precursor, so potassium nitrate, was actually combined with coenzyme Q10 and CardioNox. So that's a very easy supplement that's one a day that will not just benefit blood pressure, but actually will improve antioxidant status. Inflanox is a combination of nitric oxide precursor, so potassium nitrate, and curcumin. Antioxidant is quercetin. Rejunox is ashwagandha, and so on and so forth. So you can see how there's actually quite a bit of really good mechanistic research behind these formulations. And we looked at almost each one of these individually. We definitely looked at curcumin and coenzyme Q10 as being beneficial in their own right at protecting nitric oxide. Now you're actually going to be using a formula that's going to be delivering nitric oxide plus the anti-inflammatory or antioxidant nutrient as well. So there is a real profound synergy in a very simple product at governing vascular function. If you'd like to know more about this specific technology and AOR's approach, the NOx Advances is available to download on our website on aor.ca. So I encourage you to read more about that. And there's a chapter about the safety of nitrates. Actually, nitrates have been shown to be very safe in a lot of ways. There's a good body of human and animal data supporting the use of potassium and sodium nitrate as precursors to nitric oxide. And some of the research that has shown nitrates to be bad actually are nitrosamines and not nitrates. And those are molecules nitrates that have interacted with amino groups to form some of those carcinogenic molecules. So we can't mistake one or the other. As I mentioned, nitric oxide is like oxygen. Depending on the antioxidant status of that person, it could be pushed in different areas. And that's why all of AOR's products have some sort of antioxidants, and primarily green tea extract is in every single one of the Axioma products. So now, again, just to summarize, we looked at The blood vessel, we looked at LDL cholesterol, HDL, and the role that it plays. ApoA is lipoprotein A is a specific lipoprotein that actually will help reduce inflammation. It'll help reduce some of the damage associated with high levels of LDL, promote the beneficial effects of HDL. And we looked at inflammation and oxidative stress as being really the driving forces. And that's really my take-home point. And you can see this diagram really shows that again. Oftentimes we'll know that, oh, you know what, we just kind of stick here. We kind of cut it off. We forget about what's going on underneath the iceberg. And endothelial dysfunction is really the functional term for what's going on or what's actually going wrong at the site of the blood vessel. And oxidative stress, impaired nitric oxide, inflammation are the reasons that is going on. And over here you can see some of the reasons why that may be occurring. So when we look at vascular health, let's look a little bit deeper than what we've kind of been maybe looking at before. Instead of reaching for something that will just solely lower something like LDL, we want to look at something that's going to have a more comprehensive effect and a more root cause effect. And Cardana is one of the formulas that actually AOR has that is probably one of the most powerful formulas for reducing hypertension. I've seen this from a number of clinical experiences and also from other practitioners. When I think of this formula, I almost think of it as an ortho-adapt for the heart. Arjuna is a herb that is like the Ayurvedic Crataegus. Crataegus is in it as well. It really improves the contraction of the heart. Coleus improves the beating of the heart and regulates that. And Withania, actually, we can see now why it has some of its cardiovascular protective effects, maybe through its cortisol-reducing effects. So a real comprehensive formula. I've seen it reduce blood pressure in patients that actually have quite elevated blood pressure, so 130, 140, 150 even, and it'll take a few weeks to kick in, but in combination with a magnesium or a nitric oxide precursor, it can actually come down very quickly. One of the most underrated formulas in the AOR line is advanced cardiac support. Advanced cardiac support really personifies the preventative things when it comes to antioxidants and anti-inflammatory effects that I talked about within this whole webinar. Coenzyme Q10, Arjuna, Curcumin, and olive leaf extract all have very protective and powerful effects on improving cardiovascular function. Really an underrated formula because its main strength is prevention, but it can be used as post-surgery, post-heart attack, or any sort of cardiovascular events. Want to prevent that, have a family history of anything, can be very excellent at reducing some of the changes that have occurred and improving the antioxidant status at the blood vessel. And plus, you're going to get the benefits of the Arjuna and B6, which work on actually improving the heart function itself. So we talked about a lot of different things. A combination that I really think is a very superior combination because of all the different mechanisms we touched on. Cardio-Mag providing magnesium and orotate. We talked about advanced cardiac support. TLC improving antioxidant function plus delivering proline and lysine and vitamin C. You really are going to be hitting a lot of different areas to improve there. And CardioNox providing if you really want to help reduce blood pressure and providing coenzyme Q10. So there are a lot of great options within the line and really options that will address the root cause of cardiovascular dysfunction. So again, as I mentioned, let's try to really look at addressing the root cause, promoting functional factors, nitric oxide and vitamin C being important there, and really looking at function rather than focusing on labs, because that's really where some of the latest evidence and research is going. So I want to thank you again for listening in to this webinar and sticking with us right here to the end. Thank you so much for your continued support of AOR, and I encourage you to look at some of the resources that we have available for you through our advances. There is a new cardiovascular advances that's going to be published soon, which actually talk a lot about the different things on vitamin K and cholesterol and magnesium. So look for that, and please, I hope to see you at future webinars. Thank you very much.